Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about anal fissures. But first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel grow. So let's get started. So what is a anal fissure? So it's a small tear in the mucous membrane at the opening of the anus, okay? So this can occur when you're trying to pass a hard or very large stool. They often cause pain and bleeding, okay? So when it cracks open, it will bleed. You may also experience spasms in the anal sphincter. So at the opening, you may experience kind of spasms in that area. It is very common in young infants, but can happen at any age. And most of the time, if you increase your fiber, take sitz baths to keep it clean, it does heal quite quickly, but sometimes it does need medication or surgery. So symptoms of an anal fissure, so obviously pain. Sometimes this can be extremely severe, especially during bowel movements. And this can last up to several hours after completing the bowel movement. You might have bright red blood either in the toilet or on the tissue paper after having a bowel movement. You might be able to see a visible crack in the skin at the anus, or there could be a small lump or almost like a skin tag right at the opening, okay? So common causes of anal fissures include passing large hard stools, constipation, strain during a bowel movement, chronic diarrhea, anal intercourse, and childbirth can all cause anal fissures, okay? Now, less common causes of anal fissures are Crohn's disease, anal cancer, HIV, tuberculosis, and syphilis. So what are the factors of getting an anal fissure? So really constipation, childbirth, Crohn's disease, anal intercourse, and age. So for age, it is more common for infants and middle-aged adults. So what complications that you might run into? So failure to heal. So if you haven't healed by that 8-week mark, it is then considered a chronic problem. Now, if you're not doing things to fix the hard, large stool, it's going to just continue because it's going to continue to stretch. It's not going to heal properly. So increasing your fiber and drinking lots and lots of water will help. And then also like sitz baths, just to keep that area really clean, does really help for the healing of that area. Now, reoccurrence. So like any wound, if we're not being cautious, it can reoccur very, very easily. So just making sure that fiber and water are kind of your number one, especially because wounds take actually a full year to heal. So if you're letting it reoccur within that time, it's going to happen so easily and it's going to rip. So you just want to make sure that you increase your fiber, make sure you're having those daily bowel movements to prevent reoccurrence. And then a tear can actually extend past the muscles, okay? So this will make it very, very hard to heal, and sometimes you have to have surgery to repair this, okay? It can also be extremely, extremely painful. The pain definitely kicks up a notch at that level. So as I discussed before, prevention is really key, key to anything, but with anal fissures, definitely prevention is key. So taking measures to prevent constipation, so eating that high fiber, lots of fluids, exercising regular to keep those bowels moving will definitely help prevent the little breaks in the skin from happening. So this is diagnosed just by a simple medical examination. So they'll be able to just look at the area and be able to see it. Now, there is a difference between acute and chronic. So acute is when it just happens. It hasn't hit that 8-week mark yet. And so it's going to be a lot shallower. Kind of looks like a paper cut. Now, as we hit the chronic zone, it's going to be a larger, deeper tear, and it's going to be more painful at that point. So if your doctor does think that there's any underlying condition causing this, or it just continues to be a recurrent issue, they may take further tests. So treatment and prevention kind of go hand in hand, because some of the treatment is really what will help prevent it also. So your fiber, your increased water, those will help keep the stools soft to pass easier and prevent it from kind of re-breaking open. And then also soaking in warm water for 10 to 15 minutes, especially after a bowel movement, will help relax the anal sphincter and kind of clean out that area. The salt water will really help it. Now, non-surgical treatments, so nitroglycerin, topical pain relievers, Botox injections, and blood pressure medication might be something that your doctor prescribes. And if it becomes chronic and it's getting quite large, deep, your doctor may suggest surgery. So that's all I have for this video. I hope you did find it helpful, and I will catch you guys in my next one. See ya.